All right, hi Sam. Thank you for taking the time to answer some questions today on your last day of therapy at Functional Advantage. I was just wondering if I could first start by having you give a brief description of your life over the last couple of years and what brought you into physical therapy.
Sure, I'll be happy to answer those, whatever questions you have. I have been off balance, dizzy, whatever you want to call it, for going on to 3 years right now. And I finally wound up with a doctor that said there's no surgery that's going to cure this, there's no pill that's going to cure this, you need therapy. This happened to be at U of M Hospital in Ann Arbor. So they got me started with certain exercises to do at home, which I was faithful to do. But they suggested that I find a therapist, in the Saginaw area. So we started checking out, as best we could anyhow, different therapists in Saginaw, and we wound up with Functional Advantage.
All right. Sam, what if any were your fears or uncertainties of physical therapy itself or of starting physical therapy?
I've been to therapy before, so I didn't really have any fears of going back to therapy, other than just the normal fear of, is it going to hurt? Is it going to be uncomfortable? Are they going to have me do things that I just don't feel comfortable in doing? But it wasn't really a case of fear, and it wasn't even a case of really not knowing what to expect. But it turned out fine, no problem.
Excellent. And Sam, were your questions that you had as far as just how you answered it, not knowing what you were going to be asked to do, being asked to do things you didn't want to do, were those questions answered? Were they answered, and if so, how quickly were they answered?
I think we came in and had a discussion with you before we started therapy, of course, and my fears, my mind felt at ease at that point, that I knew that you knew what you were talking about, and that it was going to be successful. I just had that feeling.
Excellent. And on that note, how are you doing now? It is your last day. It's been almost, I think 7 weeks, roughly. Mm-hmm. How are you doing now? What things are you able to do now that you could not do before you started therapy?
If you would compare what I can do today to what I could do when I came in, it's like day and night. I couldn't sit the way I'm sitting today. I couldn't walk. I just plain could not walk. I can walk today, I think, fairly well. I do use a cane from time to time, but even without that, I'm able to do things that I just couldn't do before. I was pretty much a captive in our own house. Now I'm able to get out and do things. Yeah, and you have to remember, after just 2 months of therapy, I still have a ways to go. But I think I'm going to get there. And I'm very pleased with what I can do today compared to what I could not do a couple of months ago.
Excellent. Yeah, I've seen the changes the whole way through, and it's quite remarkable. Last question for you, Sam. I was wondering how therapy here at Functional Advantage was possibly different than other places you had received therapy.
I think the biggest difference that I see, or that registered the most with me, is that here it's all personalized. It's one-on-one all the way through. And that's something that I really appreciate. I feel comfortable in asking you questions, and I had a ton of questions. But it just helps me to feel more at ease, and I get a sense of your concern for the patient. It speaks volumes.
Yeah, well, great. Well, Sam, you've definitely done very well, and I know you're going to continue to do well, and definitely a pleasure working with you and seeing the progress along the way. So thanks for taking the time.
Well, thank you for everything that you have done.
All right, great.